Good morning, dear friends and colleagues. It is my great honor to have this opportunity to share with you about our study, thinking, and action about our medical education in Peking University Health Science Center. My talk includes 3 parts, following a very brief introduction of our university. And Peking University, as you may know, that it is the first established modern national university in China by the government. And it is a comprehensive and national key university. It has successfully educated and hosted many prominent modern Chinese thinkers, and it has also a very pretty campus. And now it is our Peking University Health Science Center. From small to big, with different names and in different forms, it is a national key university for the medical education with 100 years history, as you can see. And after we merged into Peking University about 13 years ago, we have been kept still in a comprehensive way, independent way in terms of the administration, so that we still have the administration team as a entity, as a medical education. So in structure, we have on campus, 5 schools in different disciplines. And out of the campus, we have 6 affiliate hospitals with 3 general hospitals and 3 specialized. And I believe this form of relatively independent as a medical education entity have been very important for us to conduct a systematic medical education reform, especially when we face all kinds of challenges. So compare with all other high-rank medical schools in China, whenever they merged into a comprehensive university, whenever they have been destroyed as separate part, it has very difficult for them to conduct the medical education reform. So we really appreciate this structure and the mechanisms of administration. So I have the title of Executive Vice President of Peking University, but I'm only responsible for the medical education, and we have a whole team working in this part. So as a comprehensive medical institution, we have 9 disciplines with besides the clinical medicine, which leads to a medical doctoral degree after 8 years. We also have pharmaceutical science, preventive medicine for 6 and 7 years, lead to the master degree, as well as nursing, biomedical, English, laboratory diagnosis, and laboratory experiments, which lead to the bachelor degree. So back to my talk. In the first part, this is the most roughly outline about China medical education over the past about 20 years. It has successfully provided large number of workforce for the nation, which improved the life expectancy of the people. It has tried very hard to reform in order to make it better fit the new requirement in which the government gives in some important part great support. At the same time, I realized that I share a lot of same common thoughts with Dr. Cao, that we are facing the challenges are tremendous, which are also our evidence of fundamental thoughts of the medical reform. First, as you may understand that China experienced rapid economy development, which caused environmental pollution, greatly changed lifestyle with the economies increasing and increased people's demand of the health, together with the population aging. All of this further emphasize the complex health determinants which should be considered in the construction of the disciplines in our medical education. We need not only to train the doctors, but also we need a lot of workforce for the medical related human resource. Second, China is undergoing the systematic reform. In this period of time, a strong universal coverage insurance, a strong primary care system, especially human resource in primary care, a better mechanisms for hospital survival are all needed and can't be achieved right away. Although we have been experienced about 30 years transformation, it is really difficult to transform a system from planning economy to a so-called half market economy. We need to find a right way which is suitable for China. And in the transition period, we not only have to make our efforts to meet the requirement of the society for the human resource, but also we are facing the confusion of our medical students in this kind of system. For example, the relationship between doctors and patients, and so on. And third, the rapid development of the technology, materials, equipment in medical service, and explosion of the medical knowledge lead to the stronger requirement of the complex competency of the medical students. For example, we need more emphasis on the professionalism than ever, stronger, and the communication competency, teamwork, and globalization, and so on. Fourth, the way of our medical education is mostly still in an old fashion, in that teacher and textbook are still centered. Knowledge and practice are isolated, still isolated. Thank you. So, face all of this, we think, therefore, the change should be made for medical education. So, to take a medical education as only vocational education, like we did for a long time, adopted from Russian's system, is no longer appropriate. And to simply train the doctors is not enough at all. To simply train specialists like the medical school, like us, in the clinical medicine is surely not enough. And it is not enough to teach the medical knowledge and technology only. So the transformation should include the followings for us. In order to deal with all the challenges and make the education better, meet the requirement of the student first, and then the society and the patients. Our efforts in Peking University Health and Center can be summarized briefly into followings. We have tried very hard to strengthen medical students' professionalism and overall competency by various methods, although it is not that easy, although it is not something that you just tell students what to do. It's not something only in the textbook. It is comprehensive efforts. We tried it very hard. And some new disciplines and institutions have been established. For example, in the history, we didn't have general practicing training program. Now we have it. And we have a China Center for Health Development System for the health economy, policy, administration, research, and so on. Besides that, now we have a global health department for several years, and the efforts of our professors, faculties have made very preliminary success, which had a lot of very nice impact in our government and internationally. And the curriculum remodeling, which leads to the self-learning, have been achieved also. And we provide medical students with more exposure to primary care practice besides tertiary hospital practice only, like we did for a long time, almost 30 years. And we, as a leading medical institution, we provide the government with research evidence and suggestions facing to the China's problems. And quite a few of our suggestions have been effectively applied by the government as new policies and being used in the reform nationwide. Our students' exchange internationally have become much more active than before, which benefit our students greatly in expansion of their vision, besides the knowledge gain. We are also working on the exploration of the use of modern education techniques, and so on. We still have a long way to go, but we also believe the further change, both at institutional and instructional level, are needed. Overall efforts from the government and the society, and the school, from the concept to implementation, from the propaganda to policy changing. Improving. Thank you very much to invite me to this pretty city, and I have already learned a lot from first 2-3 talks. Thank you.